Hi, good morning, everyone. Thank you so much for joining us. I'm Ariel Elliott. I run our Government Affairs Solutions at Bloomberg Government, and it's really exciting to have you all here today. So welcome to Next. We are in day 3 of Bloomberg Next. It's been a week of briefings here in Washington covering all of the priorities that are shaping the future of business and work in light of this historic election. We've talked about technology, innovation, law, and government this week, and we're very, very excited to be here today with the Better Medicare Alliance. Thank you very much for being such a wonderful partner. And with that, I would like to introduce Allyson Schwartz, President and CEO of the Better Medicare Alliance, to the stage. She's going to say a few words before we kick off. Thank you.
Good morning. Anyway, good morning, everyone. Well, it's a pleasure to be here and to see a full house. I assume you all want concrete and specific answers about what's going to happen next. You're probably not going to get those, but we're all trying to figure it out. This is feels like a bit of a new world we're in, and when it comes to all of the stakeholders in the healthcare community, we do know that President-elect Trump has made healthcare a top of list of agenda of what he wants to get done in this administration, and get done, as he says, on day one. Of course, what he wants to get done is to repeal the ACA. That's what he has said. And for those of us who understand some of the complexities of the ACA, we know potentially unraveling the complex policies around the ACA, is complex and has huge ramifications for really all of us. There's a lot of conversation right now, of course, as I think there should be, about what does it mean for those under 65 in the exchanges, 20 million people who were uninsured who now have insurance. What does that mean to them? And honestly, what does it mean to everybody else who's affected by the ACA? But today, what we want to talk about is something else that is really deeply affected by the ACA, which is Medicare. And we also know that there's some discussion by the Congress, and Paul Ryan in particular, about changes he wants to make in Medicare, full-out changes in Medicare. So we all have a lot of thinking and doing to do, I think, in the next few months. What I want to say on behalf of Better Medicare Alliance, which I now head, is that we are an organization, 75 organizations are part of our alliance, and we advocate for a program that we believe actually cuts through much of the partisan, not just rhetoric, but conversation and difficulty and gridlock that we've seen over the last many years in Congress, and that is Medicare Advantage. We do think that Medicare Advantage is, as a public-private partnership, really is driving what so many of us in healthcare believe towards a value-based financing system and a delivery system that really attends to particularly those with multiple chronic conditions who are living a long time and require a very different kind of care than acute care, more care management, more innovative interventions, viewing really a patient-centered and really understanding of the needs of patients, and create a system that is truly a health system that really attends to all those needs and improves outcomes for Medicare in a cost-effective way. So we look forward to the conversation because, and again, as advocates of Medicare Advantage, I really see this as a path forward in what is, I believe, going to still be a very divisive and difficult conversation about how we assure and meet the promise of Medicare for seniors today and the many more coming along the pike over the next few years, and also drive the conversation for all Americans about how we improve health care in a cost-effective way that really addresses the health needs of complex patients in the years to come. We know how much better how to do this today than we did even a number of years ago, and are having the kind of conversations that are driving this reform. And I look forward to working with all of you, to hearing the conversation from the really thoughtful panelists that we have this morning about how we can do this in a way that protects and assures access to good health care, but doing it in a way that does provide cost efficiency and improved care. So look forward to working with you over the next weeks and months and figuring this out together. Even as a former member of Congress, the influencers off the Hill, the thought leaders, the researchers, the doers, make a very big difference in helping to inform what we do and helping us get it right. So as one of those outside folks now, I look forward to, again, engaging in that conversation and look forward to the panel this morning. And thank Bloomberg for being very cooperative in this partnership we've had in putting this forum together. Thank you and good morning.